Terminology Podcast. This episode is Chapter 12, Part 2, Skin Lesions Number 1, Surface and Fluid-Filled Lesions. As I mentioned in Part 1, the most difficult part of Chapter 12 is getting a handle on all of the different skin lesions and distinguishing them from the different general skin conditions that cause them. As I've done before, I am going to try to reorganize and repackage the presentation of the skin lesions in a way that I hope will make them a little easier to remember. At least this is the way that I would like to approach it. First of all, what is a lesion? Well, a lesion is a pathological change in tissue due to disease or injury. Again, notice that the lesion is caused by a disease or injury. The lesion is not a disease or injury itself. It's something that emerges or erupts as a result of disease or injury. A lesion is a symptom rather than a pathology. A particular type or class of lesion could have more than one cause. Now, in this episode, we're going to talk about surface and fluid-filled lesions. Surface lesions are changes in the surface of the skin that do not break the skin. They're commonly discolorations or lumps or bumps. They're generally caused by a pathogen, an autoimmune reaction, or a trauma. Fluid-filled lesions are, again, lumps or bumps, but they're going to contain some type of fluid. Well, let's do part 1, which I'm calling the discolorations, the scales, and the crusts. The first term is macule, M-A-C-U-L-E. And a macule is a general term for any flat discolored area. We might commonly refer to them as a freckle or a mole. If there's any kind of discoloration on the skin that's flat, it's a macule. The second term is a port wine stain, P-O-R-T-W-I-N-E, and then stain, S-T-A-I-N. A port wine stain is a large, reddish purple discoloration of the face or neck. It's basically a birthmark, and it's something that when one is born with it, one is pretty much stuck with it. It's not going to resolve without a treatment. Now that's to be contrasted with the strawberry hemangioma, S-T-R-A-W-B-E-R-R-Y, and then hemangioma, H-E-M-A-N-G-I-O-M-A. A strawberry hemangioma is a soft, raised, dark purplish birthmark that's made of newly formed blood vessels. This type of birthmark will usually resolve itself by age 5, so that no treatment is necessary. Now for scalies and crusties. The first term I have for you is a plaque, P-L-A-Q-U-E. A plaque is a scaly, raised area composed of closely spaced papules. It's commonly associated with psoriasis. This type of plaque needs to be distinguished from the atherosclerotic plaque, that is, the fatty plaques that can form inside blood vessels. This is a totally different concept when we're talking about plaque in relation to dermatology. The next one is scale, S-C-A-L-E. A scale is a flaky or dry patch made up of excess dead epidermal cells. And again, this is commonly associated with psoriasis. Again, notice I've already mentioned 2 types of skin lesions that are associated with another disease. Again, the lesions themselves are not a disease. They're caused by a disease. Psoriasis is a disease. It could cause plaques, which are raised scaly areas composed of papules. And we'll talk about papules in the next section. Or psoriasis could cause scales, which again are dry, flaky patches. And the third one I have for you is a crust. A crust is a collection of dried serum and cell debris, and it's what we commonly know as a scab. A crust is the medical term for scab. Okay, I've covered 6 terms. Now I'm going to quiz you over them. Very important when we're trying to get all these lesions down to master a few at a time. Don't try to do them all at once. Again, divide and conquer. Number 1, what is the medical term for flakes or dry patches of skin that are made up of excess dead epidermal cells? Well, that's the scale. SCALE. What is the term for a birthmark composed of newly formed blood vessels? That's the strawberry hemangioma. Strawberry, STRAWBERRY, and then hemangioma, HEMANGIOMA. And a way to remember this is hopefully you'll remember a hemangioma is a tumor of newly formed blood vessels. If we're talking about the birthmark variety, it's a strawberry hemangioma. What is the term for a raised scaly area composed of closely spaced papules? That's the plaque, PLAQUE. Again, a plaque is commonly associated with psoriasis, though it could have other causes. What is the medical term for a scab? That's the crust, CRUST. Again, a crust is a collection of dried serum and cell debris, commonly a scab. What is the medical term for a birthmark that is a large reddish-purple discoloration of the face or neck that will not resolve without treatment? That's the port wine stain. Port wine, PORT hyphen WINE, and stain, STAIN. And finally, what is the medical term for any flat discoloration of the skin? That's the macule, MACULE. Okay, now we're going on to part 2, which are the lumps and the bumps. And again, unlike the textbook, I'm putting lumps and bumps together. We're talking about fluid-filled lesions as well as surface lesions here. That's how the book divides them. But I think it's a good idea just to think, okay, what are the lumps and bumps? And what are their distinguishing characteristics? Again, bearing in mind some of them have fluid, some of them don't. Okay, number 1, the bulla, BULLA. A bulla is a fluid-filled sac that's greater than a half centimeter in diameter. It's commonly known as a blister. A bulla is a large blister. Then we have the vesicle, VESICLE. Well, a vesicle is also a fluid-filled sac, but it's one that's smaller than 0.5 centimeters. So it would be a small blister. So a bulla is a large blister, fluid-filled sac greater than a half centimeter, and a vesicle is a fluid-filled sac that's less than a half centimeter. Then we have the papule. A papule, PAPULE. A papule is a red bump that is smaller than 0.5 centimeter, that's a half centimeter, and it does not contain pus. So a papule is a small red bump with no pus inside it. Commonly, it would be described as a pimple or a bug bite. A pimple or a bug bite are examples of papules. Then we have the nodule, Nodule. A nodule is a solid bump greater than a half centimeter, and it is going to go deeper into the skin surface than a papule. Now notice what I've done for you. I've given you two pairs. It really helps, again, to divide and conquer if you try to pair the related ones off or group them somehow. First, we had the blisters. And what is the name for a blister that's greater than a half centimeter? That's the bulla, Bulla. And what's the term for the smaller blister, one that's smaller than a half centimeter? That's the vesicle, Vesicle. And looking at the second pair, what is the term for a bump that's greater than a half centimeter? That's the nodule, Nodule. And then what's the term for the red bump that is smaller than a half centimeter and it doesn't contain pus? That's the papule, Papule. Okay, now we're going to add a few more. The next one is pustule, Pustule. A pustule is a raised sac filled with pus, commonly a pimple. Okay, so important distinction. A papule does not contain pus. A pustule does contain pus. Notice pustule has pus in the term, so that's a way to help you remember it. Pustule, a raised sac filled with pus. The next pus-filled lesion is an abscess, Abscess. An abscess is a closed pocket containing pus. It can be on the surface of the skin, but it could also be on other parts of the body or deep inside the body. The third one is a furuncle, Furuncle. A furuncle is a large, tender, swollen area caused by the staphylococcal infection around hair follicles or sebaceous glands, and it's commonly known as a boil. And again, it's going to have pus inside it. A furuncle is commonly known as a boil. A carbuncle, Carbuncle, is a cluster of connected furuncles. So if you have more than one furuncle and they're all clustered together, that's a carbuncle, Carbuncle. Little bit of review here. What is the term for a raised sac filled with pus? That's the pustule, Pustule. What is the term for a red bump that does not contain pus? That's a papule, Papule. And again, the papule is less than 0.5 centimeters. What is the term for a solid bump that's greater than 0.5 centimeters? That's the nodule, Nodule. What is the term for a closed pocket containing pus? That's the abscess, Abscess. What is the term for a large swollen area caused by the staphylococcal infection around hair follicles and sebaceous glands, commonly known as a boil? Well, that's the furuncle, Furuncle. And what is the term for a cluster of connected furuncles? That's the carbuncle, Carbuncle. Okay, and what is the term for a small blister, less than 0.5 centimeters in diameter? A small blister is the vesicle, Vesicle. What's the term for the larger blister, greater than a half centimeter? That's the bulla, Bulla. Okay, two more new ones. We have the verruca, Verruca. A verruca is a small, hard lesion caused by the human papillomavirus. It's commonly known as a wart. Warts are caused by the human papillomavirus. And the next one is wheal, Wheal. A wheal is a small bump that itches, commonly known as a welt, and it's often caused by allergic reactions. Okay, now I'm going to go back and review them all again with you. Number one, what is the term for a blister that's greater than a half centimeter in diameter? That's the bulla, Bulla. What is the term for a closed pocket containing pus? That's the abscess, Abscess. What is the medical term for a wart? That's the verruca, Verruca. And what is the definition of a wart? Well, the definition of a wart, or verruca, is a small hard lesion caused by the human papillomavirus. What is the term for a red bump that is smaller than 0.5 centimeter and it does not contain pus? That's the papule, Papule. What is the medical term for a blister that is smaller than 0.5 centimeters in diameter? That's a vesicle. What is the term for a raised sac that is filled with pus? That's the pustule, Pustule. What is the medical term for a small bump that itches and is often associated with allergic reactions? That's the wheal, Wheal. What is the medical term for a solid bump that's greater than 0.5 centimeters in diameter? That's the nodule, Nodule. What is the medical term for a boil? That's the furuncle, Furuncle. Again, it's a large, tender, swollen area caused by a staph infection around the hair follicles or sebaceous glands. Finally, what is the medical term for any discoloration of the skin? That's the macule. Macule. Okay, well, that covers it for the lumps and bumps and the other surface and fluid-filled lesions. In the third part of the podcast, I'm going to talk about another group of lesions. Again, it's very important that you break these down into small, manageable pieces to memorize them. It's also very useful to group and regroup them as I'm doing for you and be able to see the relationships between the different types of lesions. Okay, keep on practicing. This ends this episode of the Medical Terminology Podcast.